Exhibit 79 is a copy of my autopsy notes and diagrams that I generated on this case. It includes head and neck diagrams. It includes diagrams of the entire body and diagrams of the skeletal system as well.
Your Honor, I would move for admission of Exhibit 79 and ask for permission to publish the diagrams.
Any objection?
No.
All right, that can be published to the jury. I'll receive it, and it can be published to the jury.
And Judge, for the diagrams and the subsequent discussion, could the lights be dimmed as well?
Sure.
Dr. Tranquita, is the screen now displaying what would be the first page of Exhibit 79?
Yes, it does.
And can you note what's of importance from your medical perspective as to these diagrams?
Of course. This is the front page of what's referred to as my autopsy notes. And this allows me a front and back view of the body to depict findings. Also, a spot at the top where I can enter the general demographic features, in other words, weight of the body as it's recovered, approximated age, frame, hair color, eye color, what's the state of the postmortem changes, such as rigor mortis or livor mortis. And then with the front and back diagrams, I'm able to show sort of general findings. In this case, because there were so many sharp force injuries and injuries of the head and neck, I saved them for separate diagrams, and this is more for general findings. The most relevant ones that I want to kind of emphasize on is there is marked congestion of the head and neck, but the rest of the body is relatively pale. There were some contusions or blunt force trauma injuries of the remainder of the body. There was a contusion on the upper aspect of the left side of the chest, a contusion on the upper aspect of the right side of the chest. There were abrasions of the right upper extremity. There was a contusion or bruise of the anterior aspect of the right knee, and there was a collapsed blister on the left heel. He also had a gray metal ring that was present on the little finger of the left hand.
Doctor, on the screen, are we now showing page 2 of Exhibit 79?
Yes, we are.
And specifically, I draw your attention to the top right-hand corner of that. There's a depiction or a drawing. What is that?
In the top right-hand drawing is a depiction of the surface of the decedent's tongue. With my crude art skills, I apologize. But I'm depicting where the arc-like abrasions are present on the tongue, and that's at the tip, those curvilinear interrupted abrasions. There was a contusion of the right side of the tip of the tongue, or bruise. And then on the back and middle aspect of the right side of the tongue, there were two parallel, very patterned, very regular indentation rows consistent with a potential ligature being pressed against the neck. Being pressed against the tongue.
Doctor, based on your prior experience with strangulation cases, is that something that is typically seen or ordinarily seen where there's a potential ligature strangulation, that you may see ligature marks not only on the neck but also on other parts of the body?
Yes, it occurs when the ligature shifts during the assault. If the ligature shifts, often the victim or the decedent will try to get their chin underneath the ligature. I can sometimes see injuries across the chin, across the lower lip, or inside the mouth as the ligature is shifting in position before it's placed again on the neck.
Doctor, you mentioned that you were present on scene and had the opportunity to observe two metal dog chains that were collected by law enforcement. Is that correct?
That is correct.
And did you note any consistency between those chains that were collected and the marks that you observed on Chad Therian's body?
Yes, I did.
And what was that?
When I'm observing injuries or trying to interpret injuries, I am looking for patterns. Anything that I can use to convey to an investigator, hey, you may want to look for this at the scene. In this case, we had very organized, repeating, interrupted indentations on the surface of the tongue, very evenly spaced apart. This would not be inconsistent with the pattern of a chain and the chain links as they twist, leaving separate corner impressions on the surface of the tongue.
Doctor, does the screen now depict the third page of Exhibit 79?
Yes, it does.
And could you describe for the jury the significance of these particular diagrams?
Because there were so many findings, I separated out the head and neck diagrams to a separate diagram. This diagram depicts multiple different views of the decedent's head and neck. Similar to the photograph, we can see that there is congestion of the head above the level of decapitation. In other words, there's purplish discoloration or cyanosis or plethory of the upper aspect of the neck and head, consistent with congestion. On the right side of the decedent's face and nose is an abrasion. There are contusions at the left temple, just above the ear, and at the right temple, just above the ear as well, or bruises. Once I dissected down the neck, I found hemorrhages of the muscles of the neck on the left side and right side of the neck. I also found sharp force injuries of the outer aspect of the left eyebrow and outer aspect of the left upper eyelid, and then also on the left side of the tip of the nose. I believe that these are also post-mortem artifact because they're non-hemorrhagic, there's no redness, there's no swelling. This is consistent with cutting a body that's already been dead. Across the neck, I am depicting the point of decapitation of the decedent. This was roughly at the level of cervical vertebra C5, C6. We have about 7 cervical vertebrae, so it's just above the base of the neck, where we have complete decapitation. In other words, it's going completely through the neck, and the head is separate from the remainder of the body. There are also a number of sharp force injuries above and below the level of decapitation, consistent with multiple cuts attempted as the person is trying to get through the neck.
Now, Doctor, does the screen show what is page 4 of Exhibit 79?
Yes, it does.
I don't think I will ask you to describe every injury that's denoted on this particular diagram, as we would be here a while, but could you describe generally what is depicted in this diagram?
Of course. This is a front and back view of the decedent's body, where I'm attempting to show the points of dismemberment as well as points of sharp force injury that are present. The contusions I've also included here to try to show where they are, or bruises and abrasions. But for the most part, I want to focus on the sharp force trauma. In particular, in this case, we have the head has been decapitated at the level of the lower neck. The back has been largely flayed and defleshed. In other words, the skin of the back has been removed. Also, the muscles of the back have been removed so that we have exposed rib cage and spine. The torso, so extending from about the neck to the groin, has been bisected or cut in half at the level of the lumbar vertebra or the vertebra of the lower spine, so that we have access to the inside of the torso, both the pelvis and the upper aspect of the chest and abdomen. We have attempted amputations at the level of the right shoulder and right elbow. We have numerous cuts and stab wounds of the extremities. When we get to the abdomen and thighs, we have areas of skin removal where flaps of skin have been removed. Where we get to the right thigh, all of the soft tissue has been removed, so we're down to the bone. In other words, all we have is exposed femur for the length of the femur. When we get to the lower extremities, the left lower extremity has been amputated to the level of the knee. The kneecap or patella was recovered separately. We have another amputation from the knee to the level of the ankle, and the left foot was recovered from within the left chest cavity, placed within there. At the right lower extremity, we have, again, the femur, which has been largely defleshed, but I was able to reapproximate the pieces of muscle and pieces of skin to recreate what was there. And then we had the right knee to the right foot still intact.
Doctor, based on your training and experience, what kind of amount of time would be necessary in order to create this sort of disruption to a body?
Objection, speculation,
Overruled.
foundation.
Overruled.
It is my medical opinion that this would be quite a few hours. We have decapitation, we have dismemberment, we have transection of the torso. Subsequently, internally, the body has been eviscerated. In other words, we have entered inside the body through various cuts, both at the abdomen and between the ribs, where the victim's organs have been removed, largely one by one. We have castration of the decedent. The decedent has been castrated as well. We have cutting or sawing through chop mark injuries of the bones. It is my medical opinion that this would have taken quite a great deal of time.